and thank you very much. We are actually over time. We would like to invite the next speaker. After that, we can have a discussion. Now, let's welcome Li Donglin from the First Affiliated Hospital of Zhejiang University, and Professor Li will talk about the introducer sheath and also some case sharing. Thank you very much for the introduction. I will share my screen first. Distinguished Professor Walker and Professor Bao, all the peer doctors. Hello, everyone. Today I will talk about the application for BARTY introducer sheath and the PTA balloon. And we should say that the introducer and the balloon are quite necessary for our clinical practices. And I think we are very familiar with the mechanism. Early on, we mostly used the Cook sheath. There are some limitations, though. Sometimes there's the product access issue. So we were very looking forward to domestic brand, and it's easier for us. And this one is the BARTY product. You can see it's a 3-layer structure, and the hydrophilic coating, very good. And also, intermediate layer is the stainless steel spiral, very excellent flex resistance. And this is the locking device for dilator. So the hemostasis valve, very good. For catheter and the wire, little resistance, and also there's a radio opaque ring, very good visibility, especially when we do visceral lesion. We have higher requirements for the visibility. For peripheral, it's less challenging, and you can see this is a complete product models. You can see we have the different tips, straight ones, curved ones, and also ones for crossover in treating visceral lesions. And for diameters, we have from 4 French to 12 French. That can satisfy most of our clinical needs. As for the length, 40 to 110 centimeters. And there's ones with a Y valve, those without a Y valve, very complete product portfolio. And for clinical use, it covers different scenarios. A, B, C, D, 4 types. For the straight ones, it's better for the carotid artery, vertebral artery, subclavian, and so on and so forth. The slightly curved one is designed for the crossover, and of course we can use the straight one because it's very flexible. And for type C, it's better for the upper extremity access because we need to choose visceral artery. There's some curve if the sheath is too straight. When we want to enter into the ostium of the artery, there can be the resistance. So for visceral artery reconstruction, this is a very good choice. And also for the regular arteries, SMA, and also splenic artery. We also need the curve for, and also very good support for the short ones, the short sheath or long sheath. The tip is very safe. You can see the there's a beveled shape, and also pushability and support reach a balance, and also there's a hemostatic valve, and it can perfectly satisfy the clinical needs in different scenarios. And this is the case I remember the most. You can see there's a very severe calcification in both the iliac artery and the aortic. I needed to do crossover to reach the right lower extremity. You can see there's the cascading occlusion and very poor crossing condition. So I use the contour side and I do a crossover. However, I encountered some difficulties. From the imaging, you can see a lot of calcification and also very steep. And the iliac artery, severe calcification, and I use the wire to do crossover. That's easier. However, for the catheter to follow the wire, very difficult because it's very steep. And the pushability not so good. And I do it very slowly. And I need to push the catheter into the femoral artery. You can see from the video that it's really difficult for me. And the next step is to use the stiff wire, and I need to use the crossover sheath. I use the M+ guide wire. Actually, I already shaped it. However, when I try to cross over, really difficult. Sometimes we need to try over and over again, and we need to have a very good mechanical balance. So eventually, I crossed over with the wire. And the last step is the long sheath. For the severely calcified lesion, and we know the friction between the wall and the sheath is huge, and also you can see there's some deformation, and in such a case, BARTY medical product with very good pushability and crossability is the best choice. And for the same side, no problem. When we try to cross the curve, not so smooth. However, if we use the one with poor coating, maybe it will prove to be even more difficult. Okay, eventually we did the crossover. Actually, at the peak is the most difficult part, but after you cross over the peak, very good. Now, through the tortoise and stiff crossover maneuver, we moved on to the next step. Next one, 1T PTA balloon. We know that there are many balloons in the market. The mechanism and designs are very similar. Actually, the tip is very special, and you can see the matchability with the lumen very good, and very good the ramp, and I the mechanism and designs are very similar. Actually, the tip is very special, and you can see the matchability with the lumen very good, and very good the ramp, and I feel that the crossability very good. You can see 1.5 to 12 for below the knee, and also distal, and also for big vessels. We can use the product in different scenarios. And as for the balloon length, 20 to 220 millimeters, and also different catheter lengths. That's really convenient for us. And normal pressure, 6 RBP, less than 16. Of course, they do have a high pressure balloon. And I just mentioned that the possibility is most impressive. The tip is very thin compared with imported ones. I feel that the tip is very smooth. And especially when I go through some small lumens, the possibility is supreme. Also different sizes, and you can see there's a balloon multi-valve folding, and the release very fast and very convenient. The possibility really superb, and also there's unique hydrophilic coating formulation. suitable for crossing the occlusion and also calcified lesion. So very good inflation and very good retraction time, and it can save procedure time. So these are the advantages of the product. I would like to share with you a case. So we use it in aorta, and it's a acute trauma, and the trauma leads to the aortic dissection and left subclavial. That is the leakage, and we need to cover the left subclavial artery. It's a ER case. From the imaging, we can see it's close to this part, this left subclavian, and we put in the catheter, we put in the LSA in situ needle fenestration, and we use this technique to do the revascularization. The fenestration very smooth. After that, for the fenestration, we need to do the balloon dilation, and we dilate to certain size, and we use a bridging stand. And we did the fenestration. After that, a balloon goes through the fenestration. If the matchability between the balloon and the 0.018 wire not so good, then the balloon can push against this part, and a very poor possibility. However, for BARTY product, for very small fenestration, almost no resistance, it's a 4 millimeter balloon after dilation. You can see there's, you can see this is the balloon. That means the fenestration is very successful. And after that, we use 8 millimeter balloon to bend the fenestration to the target size. And you can see we use the 0.035 balloon, and for the very stiff graft, we recommend a high pressure balloon to do the dilation because it's safer. After that, for the next step, we are prepared to deploy the graft, and we use the Y-bond. We know that the release of the Y-bond does not need the sheath. And for the Y-bond, we need a long sheath to protect. And how can we enable the long sheath to go through the fenestration? Actually, for the long sheath, there are certain requirements. We need sometimes the balloon to lead the sheath. It's a 12F long sheath. It's big and also it's long. And you can see this angle very friendly, and no need for the use of balloon to lead the way. So with the support of the stiff wire, the long sheath goes through very smoothly, so very little resistance. After that, with the protection of the long sheath, the Y-bond was deployed and then released. You can see the revascularization results are very good. So the sheath and also the Heety sheath and the 1T PTA balloon, you can see the characteristics are very good and very unique. And for the vascular surgeons, we need to sharpen our weapons before going to the battle. Those weapons for us are very useful. In the regular cases, we may not feel the difference between different products. However, in dealing with complicated cases, we may feel the absolute advantage of the good products.
Thank you very much. Thanks for Professor Li. And especially you mentioned about the primary fenestration case. And that is a very good case, very interesting. And we're going to have 4 panelists to join us for the discussion. Professor Guolian Rui from Xuanwu Hospital Capital